Upstate Medical University in Syracuse, New York, invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. A blood test is available that can help detect early signs of Alzheimer's disease, and we'll hear all about it from Dr. Sharon Brangman. She's the chief of geriatrics at Upstate, where she is a distinguished service professor and the director of the Center for Excellence for Alzheimer's Disease. Welcome back to The Informed Patient, Dr. Brangman.
Thanks for inviting me again, Amber.
Now, this blood test cleared the Food and Drug Administration a few months back. What can you tell us about it?
Well, unfortunately, it's not cleared yet by the New York State Department of Health. So I think we're the last state to get this final approval, which we hope will be coming at some point soon. But I can tell you about the blood test in general and its role in how we might use it for making a diagnosis of dementia in a patient.
Does it have a name? What would a patient call it?
I don't think it has a formal name yet, and maybe with approval it will, but right now we call it a blood biomarker test for Alzheimer's disease.
So what is the biomarker that it looks for?
There are some people with Alzheimer's disease who get a buildup of an abnormal protein in the brain called amyloid, and another one called tau. And what these proteins do is they kind of destroy the nerve cells in the brain, and they do it in a way that's a hallmark of Alzheimer's disease. And it turns out that these abnormal proteins are also present in our bloodstream. So this blood test can pick up those abnormal proteins that are circulating in the blood, and they give us a pretty good idea about the buildup of these same proteins in the brain. Now, currently, the way that we do evaluate for the buildup of these abnormal proteins is either by doing a special amyloid PET scan, which is a special kind of MRI of the brain to pick up these abnormal proteins, or we can do a spinal test because these proteins are also present in the spinal fluid. The special PET scan of the brain is expensive, and many insurance companies won't give authorization for it to be used. And a spinal test is invasive. It's a little painful and awkward. You have to be very careful after you have it done. So having a blood test is a less invasive, less expensive way of giving us some information. But the blood test has to be used very carefully.
We hear about amyloid, at least in TV commercials, and you said that these are abnormal proteins, amyloid and tau. They're abnormal, but do they develop naturally? Are they naturally occurring in our bodies at some point?
No, they're buildup, and the big mystery is what triggers them to start forming. And there's a lot of theories on what triggers them to start accumulating. The other piece is many people who have this amyloid buildup never get Alzheimer's disease. So we think that it could be a combination of something in the environment or some other factor that work in addition to the amyloid to cause Alzheimer's disease. The other thing is that there are many other types of dementia. So if you get this blood test and it's negative, it doesn't mean that you don't have another type of dementia. So the blood tests have to be used very carefully by people who are informed and can help you interpret those results.
So it doesn't sound like this blood test is designed for someone who just asks, wow, do I have Alzheimer's?
No, absolutely not. And the commercials can be a little misleading because normal aging is often associated with some problems with our memory. So you may forget where your cell phone is or your car keys. You may forget an item on your grocery list. But if it doesn't interfere with your function and if it's not a serious thing that you forget, like if you forget a really important event or people who were there, that's different. So as we get older, it takes a little while for us to retrieve information from our brain that's been in there. It's kind of like a computer. The way I explain it is a computer with a hard drive that's full of files. And as we get older, we have more and more of those files. So it takes a little bit longer to rifle through those files and get that information out. And so everyone gets worried when they forget someone's name, or they are talking and they lose their train of thought or something like that. That doesn't necessarily mean that you have Alzheimer's disease. And it really takes a skilled healthcare provider to help sort that out. So my concern is that people see that commercial and think, oh my gosh, I must have Alzheimer's disease. I better get that blood test to prove it. And that blood test alone is not the way we make the diagnosis. The diagnosis of Alzheimer's disease involves some clinical information as well as objective information that we might get from doing some memory testing. And then it may be confirmed with a blood test. But you really shouldn't start out with a blood test.
This is Upstate's The Informed Patient podcast. I'm your host, Amber Smith. I'm talking with geriatrician Dr. Sharon Brangman from Upstate's Center for Excellence for Alzheimer's Disease. She's telling us about the new blood test to help diagnose Alzheimer's. Can you describe how you would use this test once it's approved in New York State? Who is it really designed for? Are there certain patients that you might use it on and certain patients where it wouldn't be useful?
The ideal person would be somebody who's had a comprehensive evaluation. That means they have a memory concern and they come in to their doctor's office and they get a comprehensive evaluation. This includes getting a history of the memory problem, doing a physical exam, getting blood work to make sure that there aren't other abnormalities going on, reviewing medications, because there's a lot of medications that might kind of jumble up things in our memories and make you think that you have dementia, getting screened for depression, because again, depression can sometimes overlap and make you think you have dementia. So in other words, you get a comprehensive test that then, with objective findings, leads us to think that you might have Alzheimer's disease. And then if you are considering getting treated with any of the anti-amyloid medications that are available, you would get a blood test to see if that confirms our thinking about amyloid buildup in the brain. It should not be given for anyone who is concerned because maybe Alzheimer's runs in their family and they have no symptoms whatsoever, but they just want to know. That's not a good reason to get the blood test. Or if somebody, like the commercials suggest, are forgetting their car keys, they shouldn't come in and get a blood test, because a blood test alone does not make the diagnosis. And if the blood test is positive for amyloid, that may not mean you have Alzheimer's disease. And if it's negative for amyloid, it does not mean that you don't have Alzheimer's disease. So in other words, one test alone does not make the diagnosis. What I'm concerned about is it's going to create a lot of anxiety and worry, because then people get this blood result and then they think they have it. And it may lead to a lot of unnecessary interventions and procedures that really lead nowhere.
If you do have a patient that you suspect does have Alzheimer's and they're considering taking one of the amyloid lowering medications, and they have the blood test and it shows a buildup of amyloid, and they start taking the medications to reduce it, would they take the same blood test later to see if it has lowered the amyloid?
So here's the thing. We cannot base treatment on the blood biomarkers at this time. So if we work someone up and we think they have Alzheimer's and they have a positive blood biomarker test, then we still have to get the specialized PET scan of the brain or a spinal tap. Because right now, these tests are not used to monitor treatment or initiate treatment. They have not been refined enough. The other thing is that these blood tests have not been validated or tested in broad groups of diverse populations. So we do not know if this test applies the same information to everyone because it hasn't been tested broadly in all types of people. The other thing is we need more research to know if somebody has no symptoms at all, but they have a positive blood biomarker for amyloid. We need to know, does this mean they're going to get Alzheimer's disease? And there are some tests going on right now to kind of follow people over time. Because as I said earlier, most people do not progress on to Alzheimer's disease, and we have to find out who tends to progress and who doesn't and why. So there's still a lot of information that we need. And if you don't have enough background and information and understanding about the appropriate use of this blood test, I think it's going to create a lot of worry and anxiety, and some of it may be totally unwarranted.
Are there other blood tests in use to help diagnose Alzheimer's disease?
So they're looking at other abnormal filaments and proteins, again, that are in the brain. They are not yet ready for market, but this follows much of the work that's been done in cancer, where there are certain tumors that put biomarkers into the bloodstream to help make a diagnosis of a cancer. So science is progressing in that we are now understanding that many cells, when they break down, send out different signals and proteins and other cells that we can pick up to help refine our diagnosis or make an early diagnosis. We're still pretty much in the early phases of determining what to do with all the biomarkers, especially for Alzheimer's disease.
Well, I imagine a lot of listeners have heard about blood tests for Alzheimer's disease, and maybe there's a heightened interest in this. If listeners over age 55 want to learn more or think that they want to be assessed for development of Alzheimer's or dementia, how do they get in contact with you?
If you have a concern about your memory and you want an evaluation, you can contact our Center of Excellence for Alzheimer's Disease. Our phone number is 315-464-5166, and you can ask for a new patient evaluation. And what we do is a comprehensive evaluation. Some people who come with a memory problem do not have Alzheimer's disease. And so we often reassure people, or we review their medications and find out that there's medications that might be causing side effects that make you look cloudy and foggy and you don't really have Alzheimer's disease. Sometimes it's depression. So every memory problem is not Alzheimer's disease. But we now have direct-to-consumer marketing, which puts information into people's heads without the medical information behind it, so that they have no way of sorting things out. So you really need to come and get things sorted out and not make an assumption that, oh my gosh, I have Alzheimer's disease, I'm doomed, this is it.
Well, I think it's also important, the point you made about even if you're found to have amyloid and tau, that doesn't mean you're developing Alzheimer's.
Exactly. We need more information to see what does that mean. But these biomarkers are going to be very useful tools. They just have to be used carefully. They did a study, I think last year or the year before, with primary care doctors who had patients who would come in and say they had a memory concern. And they found that primary care doctors were about 61% of the time accurate in making that diagnosis. But when they added the biomarkers, their accuracy in making the diagnosis went up to about 90%. So they can be helpful in clarifying a diagnosis, but it has to be in people who come in with a memory problem, not people who are just walking around with no symptoms misplace their car keys and say, oh, I need a blood test. Those are not the ones to get this new blood test. And hopefully when it becomes available in New York State, there will be more information and guidance, because healthcare providers have to be comfortable in interpreting the results and discussing the results with patients. Otherwise, we're going to have a lot of worried, anxious people who really don't have anything to be worried about.
Well, this is really good information, and I appreciate you making time to share it with us. Thank you, Dr. Brangman.
You're welcome.
My guest has been Dr. Sharon Brangman, Upstate's Chief of Geriatrics and a Distinguished Service Professor who oversees the Center for Excellence for Alzheimer's Disease. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe, with sound engineering by Bill Brokel and graphic design by Dan Cameron. Find our archive of previous episodes at upstate.edu/informed. If you enjoyed this episode, please invite a friend to listen. You can also rate and review the Informed Patient podcast on Spotify, Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.